Hello everybody, my name is Nicholas Bavona and I'm here to talk to you guys about the dangers of opioid and pain relief drugs. Opioids are a class of drugs that include the illegal drug heroin, synthetic opioids such as fentanyl, and pain relievers available legally by prescription such as oxycodone, hydrocodone, codeine, morphine, etc. All opioids are chemically related and interact with opioid receptors on nerve cells in the body and brain. They produce euphoria and addiction to pain relief, which can lead to dependence, and when misused, opioid pain relievers can lead to addiction, overdose incidents, and deaths. First drug I'm going to talk about is heroin, an opioid drug made from morphine. People inject, sniff, snort, or smoke heroin. It enters the brain rapidly and binds to opioid receptors in areas involved with pain and pleasure. Effects of using heroin include collapsed veins, infection of the heart lining valves, liver and kidney disease, mental disorders such as depression and antisocial personality disorder, and insomnia. There are many other side effects that come from heroin, but these are just some of the few most important ones. Another drug is fentanyl, a powerful synthetic opioid that is similar to morphine but is 50 to 100 times more potent. It is typically prescribed by a physician to treat patients with severe pain or manage pain after surgery. Fentanyl acts the same way as heroin, morphine, and other opioid drugs. It binds to the body's opioid receptors, which are found in areas of the brain that control pain and emotion. High doses of potent opioids such as fentanyl can cause breathing to stop completely, which results in death. Two other very common prescription opioids are Oxycontin and Vicodin. Prescription opioids used for pain relief are generally safe when taken for a short time, but they can be misused in ways such as taking medicine in a way other than it is prescribed, taking someone else's prescription, and solely taking it for the effect it causes to get high. The last important opioid drug I'm going to talk about is codeine. Codeine is used to relieve mild to moderate pain. It is also used, usually in combination with other medications, to reduce coughing. It may be inhibiting to forming a habit and can cause life-threatening breathing problems and is very addictive. But what I really want to touch upon codeine is that it is very widespread throughout the hip-hop culture. Considering that most of you guys are younger generations, a lot of you like hip-hop music and probably are aware of artists such as Young Thug as seen in the top right, Lil Wayne in the middle, and A$AP Rocky in the bottom. These rappers and other rappers continually refer to drinking codeine or promethazine syrup as a way to promote their music. While these are very extreme drugs, their prevalence in younger generations still exists, which is why it's very important for you guys to take this information seriously. This is a table showing the prevalence of drugs in 8th graders, 10th graders, and 12th graders in 2017. While the percent of heroin is very low, it is still prevalent in these cases. Oxycontin and Vicodin are higher because these types of drugs can be found in medicine cabinets in your home, and kids are more easily susceptible to finding them and taking them without knowing what they are, and this results in addiction in lower ages, which is a big problem. Here we have a national survey on drug use and health, trends and prevalence of various drugs for ages 12 or older, considering ages 12 to 17, ages 18 to 25, and ages 26 or older. In 2017, we can see that heroin was typically lower than 1%, but pain relievers you can see ranges from 3% to 7% of these various age groups. So it is important to recognize again that pain reliever drugs versus illegal drugs found on the street are more prevalent. I hope this presentation was successful in informing you on the dangers of opioid and pain relief drugs. Be responsible with your medication, stay out of other people's medicine cabinets, and most importantly, do not do drugs. Thank you for watching. I hope this helped.